let's talk a little bit about the lasting legacies of PEPFAR. And I think a lot about how to talk about PEPFAR, what was achieved, how it was achieved in the last 20 years. And sometimes I go through principles that have stuck, but I think really the way I think about it now is lasting legacies. What are the lasting legacies of PEPFAR? One, of course, is the massive saving of lives, the turnaround in countries by really saving communities. For those of you who were there at the moment, for those of you who were in the United States in the early before we had antiretroviral therapy widely available, what it felt like in San Francisco or Boston, the hopelessness was nothing compared to what was happening in Africa. As a reminder, for those of you who didn't follow this, 30% or more, up to 40%, 38% of some countries had their young people, 50 and under, infected with HIV, 35 to 40% of their adult population. All were going to die. In some districts in Botswana, 75% of pregnant women were infected. Literally, countries were going to cease to exist. An entire generation was going to be knocked out. That saving of lives is a tremendous and lasting legacy. But there are other legacies that I think are worth considering as we think not only where we are now, but the reauthorization of PEPFAR and looking to the future. The first is that